What business is it?
In the video we just showed, Justin, who works for me, does exactly that. He has a high deductible policy that he can afford because I pay slave labor wages. So if he were in Massachusetts, he has coverage. He is paying into the system. He is being a good consumer because he has a high deductible. He has to pay for his first $5 grand. But in Massachusetts, he can't buy that policy. It seems to me that he's doing the right thing. He is a responsible young man who is covering himself. But the government says you can't have that policy. You have to have the more expensive policy. And that seems wrong to me.
And it's not good outside of Massachusetts. I pay all this money for a Massachusetts policy. They don't cover anything outside of Massachusetts.
Let me ask this question, though. What if he chose not to get any insurance at all, and then he had the accident with the bus that you showed on the video, and he doesn't have the money? I mean, that's going to end up costing taxpayers money in some way, and he didn't contribute. So, you know, we can argue about the size of the deductible, but the theory that everybody should be participating, I think, is something that has logic behind it.
Everybody does participate through the tax system. And, of course, they can go back and garnish his wages for the rest of his working life as well.
But isn't there a fair point that there are a lot of freeloaders who know that if the poop hits the fan, I'll just go to the emergency room and they have to treat me, but I'm 25 years old, I'm indestructible, and I don't want to pay for it. They're being foolish, but you know, they're young. You know,
it's sort of like the American bank system. Heads I win, tails you bail me out.
The mandate is a worse solution than the problem that you're trying to cure. The problem you're trying to cure costs me about $70 a year. The cure that's proposed under Obamacare is going to cost me thousands and thousands of dollars a year and not improve anything for anyone. So, you know, free riders are everywhere, yes, but you can minimize them by taking appropriate policy. This is not it.
Tell you what, let's take another look at one of these great animated features with this incredible voiceover. We hired a great guy to do that.
I was very impressed.
Let's take a look at video number 2.
Once the government is in charge of healthcare, bureaucrats and not doctors decide who gets what treatment. Take Oregon. Every year, politicians there create a priority list for Medicaid patients. The higher your illness gets on the list, the better the chance you'll be treated. As soon as they start drawing up a priority list, special interest groups start lobbying to get their favorite ailments bumped up, meaning others get bumped down. Soon, serious illnesses like head injuries and Addison's disease end up getting treated only if there's money left over from more politically popular treatments, like substance abuse and birth control. So now in Oregon, medical coverage is like a game show. Got advanced prostate or breast cancer? Not covered. Have an open wound of the eardrum? Not covered. Acute respiratory infection? Not covered. Want help to quit smoking? That's covered. Need support losing weight? Well, that's covered too. Acute anal fissure? Ugh. Sorry, not covered. Moderate depression? Lucky you. You're covered. Antisocial personality disorder? Well, maybe if you weren't such a jerk, you'd be covered. But hey, they say this kind of special interest lobbying and treatment rationing won't happen under Obamacare. But if you believe in responsible health care reform, join us.
Right, now, when it comes to Medicare, this is something that you guys would deal with all the time. As an elected official, you have to decide how this money is going to be spent. So we already have a government-run system called Medicare. We have another one for the VA. We also have another one for American Indians on reservations. You know, isn't there a push of what's going to get covered when you have only a certain amount of money to spend?
But that's true of a private healthcare system too. I mean, you're never going to give all the possible care to all the possible people that want it. You know, for instance, I mean, to take an extreme example, if a 87-year-old person has stage 4 cancer and there's some kind of extreme therapy that costs $100,000 that might prolong their life for a very short period of time, there's no system in the world that can afford that. And so, and we have, if rationing is kind of used as a pejorative term, I mean, to talk about public healthcare systems, but we ration now with private healthcare systems because they hire huge numbers of people to every time there's a claim to see if there's some way they can get out of it. That's what private health insurance companies do. So they ration as well. So there needs to be some logical way to say we're going to give the best care that we can afford as a society, and that's always going to be difficult decisions.
And these examples coming from Oregon, this is for the medical system that the government runs, and politics is politics. If you have enough people on your side.
Profit is profit.
And profit is profit. But if there's enough people pushing your side, these treatments get bumped around by politics. How else would it get done?
Well, it's pretty clear that the public rationing is very, very different than the private insurance company rationing.
How so?
Because most of the health care spending in the U.S. is still controlled by the private sector. The private sector is much more likely to spend on treating people who are sick and have a painful problem than the public sector is. You don't have the long waits. So the private sector is tuned to provide sort of immediate care, to do the most aggressive treatment they can figure out to get you well and back on your feet. Why? Well, it saves employers money if they have a healthy, and by the way, it's not true that insurers try to get out of claims. You know, if you're dozens and dozens of people who have very, very serious problems, you're one of them, and the company pays. I mean, that's what they do. And if not, I can call in the government. But if the government decides to tell me, well, I'm not going to cover your cancer because you've got less than a 5% chance of surviving 5 years, which is the rule in Oregon, there's nobody to call in to police them to make them live up to their contract. Yeah, they just simply do whatever they want. That's the problem in Canada. That's the problem in Britain. The private sector looks at things very differently than the public sector, and the kind of rationing you get is very different.
Is it fair to say that, you know, in Oregon, when you take a look at the Medicare system, and that's run by states, it's paid for by the feds, but it's largely administered by the states.
I think you mean Medicaid.
Medicaid, but yeah, Medicaid. Excuse me. When they do that, they have to deal with political pressures. You guys are elected officials, and if there's more people that want this particular treatment or this particular ailment to go up on the list, what about the guys who don't have as much political clout? Don't they lose in this system? Whereas in a private insurance, yeah, they make profit, that evil profit, but and I've got a handicapped child, and if they don't pay up for what they're supposed to by the private contract, I get to sue them. Isn't there a difference there? Doesn't the less popular or less politically powerful illness have some more coverage under the current system or more leverage?
Well, you know, I think I'm going to have to disagree that when a company's trying to make profit, that they're going to do a better job of providing health care than a government entity that's actually trying to provide health care. The profit motive makes these companies deny people coverage if they have a pre-existing condition. So that's somebody that actually needs health care and they don't get it from private health insurance. They will rescind your coverage even if you've been paying your insurance for a while and they find that you didn't put in something in one of the original documents and now you've got a big claim. It might have been totally unrelated, but they'll look for a way to rescind your policy. So they have exclusions, deny, and they exclude certain things like they exclude autism, which I know about some insurance companies. So, you know, you wouldn't do these things. You wouldn't deny people who need care because they have autism or a pre-existing condition care if you were trying to provide care, but you would do it if you're trying to make a profit.
It's true that they can deny you for pre-existing conditions when you get a policy for individual policies. Here in Colorado, if you're on a group policy, it doesn't matter what you have. Am I right?
Employer-provided policies, yeah. If you can work, you can be covered by that policy. If you want a medically underwritten individual policy, then you have to pass the medical underwriting, you know, standards. And it's not true that they can cancel your policy. The rescission that you're talking about is only good for 2 years. It's if you lie to them and have a big claim, they go back over everything. Otherwise, they don't. After 2 years.
Same thing, for instance, in life insurance.
Right, same thing.
I say that I have a good heart, but it turns out that I have heart disease, and I didn't tell them about that.